Welcome to the Mind Project website. This podcast provides professional development for teachers considering implementing the Virtual Stroke Lab, a free virtual lab available from the Mind Project. Our goal in this online tutorial is to provide teachers around the world with the introductory training that we offer in our face-to-face workshops. This tutorial will cover the following topics: a brief background on the Mind Project, an introduction to the lab, lab objectives aligned with standards, science and health content topics covered in the virtual lab, teacher implementation support for each of the 3 sections of the lab, addressing misconceptions that students may have after completing the lab, assessment suggestions, descriptions of various teacher and student resources to accompany the lab, and the tutorial ends with tips for getting started. The Virtual Stroke Lab was designed to provide a fun and engaging way for students to learn about strokes by experiencing diagnostic medicine from the perspective of a radiologist. Because students read factual information only when they need to make a decision regarding their patient, they learn a lot about the health and science facts in context with a problem they must solve. This learning is just in time instead of memorizing facts that may or may not be helpful later. There are 2 versions of the Virtual Stroke Lab. The first is called the basic version and should be used with students if they will be able to sit and complete all 3 sections within the lab in one sitting. However, if you would like to have students do the sections at different times, you should use the flexible version. This allows students to jump to parts 2 or 3 without having to complete the previous sections. We have separate student entry pages for the basic and flexible versions. Be sure to provide your students with the URL for the versions of the lab that you want them to use. Make sure your students read the electronic medical record or the EMR to determine how to interpret these images. As an additional diagnostic test, students will order and read a 3D CT head angiogram image to locate the aneurysm. An important concept that students should glean is that stroke treatments depend on the type of stroke and where in the brain the stroke occurred. Most strokes are ischemic, and if patients get treatment within 3 hours of symptoms, clot-busting medications can minimize long-term damage. A smaller percent of strokes are hemorrhagic. In this virtual lab, the bleed comes from an aneurysm, and your students will decide what type of surgery will best strengthen the aneurysm. Besides diagnosing and treating strokes, which may or may not be one of your curricular goals, you can also use this virtual lab to introduce or reinforce more narrowly focused topics. For example, you could use the Virtual Stroke Lab as a way to connect the respiratory system and circulatory system. What better way to highlight the importance of delivering oxygenated blood to the brain than diagnosing and treating a stroke? To help students see connections between structure and function, consider focusing on vessel anatomy. Have them brainstorm how damage to vessels affect the body. They may come up with several: heart attacks, organ failure, as well as strokes. You could focus on why not enough blood, ischemic, or too much blood, hemorrhagic, cause so many similar stroke symptoms. Or maybe a study of how aneurysm structure impacts brain function might better interest your students. They could also connect brain damage of specific areas of the brain with how it impacts patient function. In addition to all the great science and health content students receive as part of the lab, the Virtual Stroke Lab also highlights careers in the health field. The neuroradiologist is the career that is featured in this lab, but there are other careers in radiology that do not require medical school. Students could become EMTs, nurses, or radiology technicians. The Virtual Stroke Lab can also be used to highlight societal issues. You could address the importance of having an informed public regarding stroke treatments and how this affects permanent neurologic loss. Or you may choose to have students consider how lifestyle choices such as diet and exercise affect incidences of stroke and then factor in the cost of health care. As students begin the lab, they are prompted to read EMR entries to help them make decisions regarding their patient, Mr. Jones. Students work between the EMR and the continue buttons, answering questions along the way. The answers to these are summarized in their doctor notes. The first question students must answer is regarding their patient's history. Students are asked which are considered risk factors for stroke. All of the answers should be selected except allergy to penicillin. While the patient, Mr. Jones, does have this allergy, it is not a risk factor for stroke. The patient has a Hunt and Hess score of 3 and has most likely had a hemorrhagic stroke. The appropriate diagnostic test is a CT head scan without contrast. Ordering a CT head scan without contrast will determine whether the stroke was ischemic or hemorrhagic. In this section, the patient is in the CT room and students must refer to the EMR to gain introductory skills in how to read CT scans. Make sure students understand that the images show cross-sections of the head and that varying shades of gray and white indicate different diagnoses. In this CT scan, the bleed shows up as a white area. Students will click and drag to highlight the bleed. In the 3D CT head angiogram image, the aneurysm can be viewed as a gray, bulb-shaped vessel. Now the patient is in the neuroendovascular suite. It is important that students understand that they will be accessing the blood vessels in the brain by entering the femoral artery in the groin. Students will simulate the embolization surgery by the insertion of needles, guide wires, and coils into the blood vessels of Mr. Jones. Students will use the line control to move the guide wire through the vessels. Once into the patient's neck area, move more slowly and twist the line control to move into the correct vessels. Even though the student tutorial reminds students that the human image on the right is only for the benefit of this simulation and does not represent the actual procedure, it may be helpful to remind students of this. The roadmap from the groin to the brain includes the following blood vessels: femoral artery to the abdominal aorta, to the thoracic aorta, to the left common carotid artery, where an aneurysm will be identified in the left internal carotid artery. It's treatment decision time. The student now has a variety of data, images, and information about the aneurysm and will be asked how to treat it. Student should refer to the EMR and read sections titled Aneurysm Treatment Options, Importance of Aneurysm Neck Size, What is a Working Projection, and Complications from Coiling. The DSA and 3D DSA revealed very important information regarding the structure of the aneurysm. It is a 5 mm aneurysm with a 2 mm neck. Students get this feedback after the test, and it is permanently recorded in their doctor's notes. The EMR entry, Importance of Aneurysm Neck Size, will help them determine whether or not they should clip or coil the aneurysm. Because the neck is smaller than the aneurysm itself, the coils will stay in place and make coiling the best option for this patient. The CT head scan determined that it was a bleed and therefore was a hemorrhagic stroke. The location of the bleed classifies it as a subarachnoid hemorrhagic stroke, which are caused by trauma or aneurysms. The 3D CT head angiogram confirmed the cause to be an aneurysm. The digital subtraction angiogram, or DSA, provided important details of the aneurysm structure, which make it a good candidate for the endovascular coiling procedure. Students will simulate the coiling treatment procedure on Mr. Jones's aneurysm. Students will thread a microwire and microcatheter through the main catheter up into the neck of the aneurysm. In order to embolize the aneurysm, students thread coils of different sizes through the microcatheter and into the aneurysm with the goal to insert just enough coils to block off the aneurysm, which will reduce blood flow and thus eliminate the pressure and prevent further bleeding. In reality, when coiling an aneurysm, a neuroradiologist will study the 3D image of the aneurysm carefully to determine how many coils to use and what size they should be. The structure of the aneurysm determines this. Usually, as in this lab, the larger coils are inserted first, with smaller coils being used to fill in the gaps. These platinum coils have specially designed shapes, but are stretched straight and spring-loaded into a microcatheter during the delivery process. When pushed out of the sheath, the coil take on their preformed shape and gently push against the walls of the ballooned aneurysm, providing strength and support to the weakened vessel. After the final coil has been inserted into the aneurysm, taking final DSA and 3D DSA images help confirm whether or not blood continues to flow into the aneurysm. Therefore, just because the aneurysm is not visible does not mean that the structure has been removed, only that blood is not flowing into it anymore. And that was the goal of the surgery. After this has been confirmed, students are congratulated for a job well done. While this lab realistically simulates a neuroradiologist's treatment of a stroke patient, there are aspects of the lab where the students might pick up misconceptions. Therefore, I want to highlight these so you can clarify them as you work with your students. First of all, students may presume that because imaging and procedures go quickly in our simulation, that this is also true in real life. But realistically, it can take hours for the neuroradiologist to locate an aneurysm using CT angiography. If the process to enter the body and access the brain via the femoral artery seems tedious and complex, it is. In reality, this process can take several hours. The reason so many different guide wires and catheters are needed is that the blood vessels narrow and become more fragile as one gets closer to the brain. Too narrow or flexible of a catheter in large blood vessels will not make sufficient progress towards the brain. Too large or rigid of a catheter can damage or rupture the smaller blood vessels. Because students become a neuroradiologist, they may assume that these doctors work in isolation and that they perform all of the tasks simulated in this virtual lab. However, in reality, the neuroradiologist consults with other physicians before making these difficult decisions. And other health professionals such as EMTs, nurses, and radiology technicians are working with the neuroradiologist throughout the patient's time in the hospital. Therefore, students do not have to go to medical school to work in a radiology department. There are many careers that support this work. Students might also presume that surgery is always the best option. Just because this virtual patient had an aneurysm that could be treated with surgery, this is not always the case. Sometimes the only mode of treatment is to monitor the bleed or aneurysm regularly and watch for any changes. Lastly, because this lab focuses on hemorrhagic strokes, students may incorrectly assume that hemorrhagic strokes are the most common. But in reality, a majority of strokes are ischemic, caused by blocked arteries. Because the lab was designed not to focus on minute details, we prefer that students experience the virtual lab without having to complete additional assignments. However, we do have a handout that asks big picture questions to be sure that students have focused on the main concepts of the lab. There are various resources that we have available for you as you facilitate your students' progress through the virtual stroke lab. There is also an NBC nightly news report that describes the coiling procedure.
In health news tonight, a development in the detection of brain aneurysms. They can strike and kill without.
You might consider having students view this after they complete the lab. There are also quality animations or actual surgery video of the coiling procedure available elsewhere on the web. Both the basic and flexible student entry pages include the navigation and overview tutorials. We suggest that everyone who completes the lab first view these tutorials. We are always interested in knowing the teachers who decide to implement one of our labs. Please email us to let us know you are considering using it. We would be happy to support you in any way that we can. You may also want to inquire if we are offering any pilot testing incentives. At times, we pay teachers to implement labs with students. This includes some pre-post testing surveys for both the teacher who implements the lab and for the students who complete it. What's the next step? Well, if you haven't already, on the homepage of the Mind Project website, create a user account and become a Mind Project member. Familiarize yourself with the student tutorials associated with the virtual stroke lab. Decide how the lab best fits your current curriculum and how you could implement it. Contact us and let us know who you are and how you plan on using the lab, and we will let you know if there are any new support materials to make your job easier. And lastly, implement the virtual stroke lab with your students. Thank you for watching this professional development tutorial for the virtual stroke lab made available from the Mind Project. I hope that you found it useful as you decide whether or not to use the lab with your students. Please feel free to contact us with any questions that you may have. And don't forget to look at the other free virtual labs that we offer.